This chapter talks about cultural aspects of psychiatric nursing. Okay, so culture um, definition here describes a particular society's entire way of living, shared patterns of beliefs, feelings, knowledge that guide conduct and are passed on from generation to generation. Ethnic, ethnicity is not the same as race. Instead, it's more of a biological term for groups of people who share similar characteristics. When we look at culture and ethnicity, we have to be careful because we can't assume all people who share a culture or ethnic group are the same. That is stereotyping, and we don't want to do that. And there are many variations of behaviors and beliefs within a culture. Um, while some individuals may maintain those traditional um, cultural practices, there are many who have incorporated their practices into um, a mainstream culture. So we need to not make assumptions um, that because of someone's ethnicity or culture that they are going to have the same beliefs. We need to ask questions and find out on that specific person rather than making an assumption. So communication has its roots in culture, expressed through language, um, gestures, paraverbal communications. And we have to understand what the patient's needs and expectations as they are being communicated. So we need to ask questions about that. Phenomenon of space. It's the territory, the density, and the distance for a in a certain culture. Uh, t- um, there is a culturally appropriate space that people tend to have. Your bubble. Sometimes our bubble is different, and of course, it's always different by by who you're communicating with. A close family uh, member, you're going to have a closer space when you're communicating than you are with someone you don't know. In our Western culture, um, up to 18 inches is an intimate zone. 18 inches to 3 feet are a personal zone, and a social zone is 3 to 6 feet. That is in our United States culture. In a different culture, they may have different spaces. And again, it can be very subjective. Someone you know, someone you don't know. That's why it's always nice to ask someone before you enter their bubble if you need to. Tell them what you're doing and give them an idea of what you're going to need to do. Um, Touching a person in some cultures is very disrespectful. Um, so if we need to do that and someone has those feelings, we need to explain why we need to do that. Social organizations, groups that the person belongs to. This could be their family, a religious group, or an ethnic group. Time. Some cultures have a great value on time, where others may not have time doesn't mean a whole lot to them. So this is something to remember when you were telling someone that they have an appointment at 2:30 to meet with their psychiatrist. Um, knowing their time frame, so that they get where they need to go on time. If they time isn't really clock time isn't important to them, then um, we need to explain to them more about how your appointment works and what time they need to be there and understand that. Environmental control. Um, this is how much the person believes that they have control over their environment. And our cultural beliefs and practices will um, depend on our perception of the environment when we are well and ill. Biological differences, body structure, skin color, psychological responses to medications, EKG patterns, susceptibility to disease, nutritional preferences, and deficiencies. All things important to know, um, just to be able to provide good medical care to a patient. And individuals' expectations for health care. There are different types of cultures. The individualistic culture, people need to take responsibility for themselves and what they want, and without consulting community or family. The collectivist culture really highly values the input of their family or friends and may rely on their judgment to make medical decisions for themselves. We need to be aware before we provide care to a patient that we have awareness of our own cultural values, behaviors, and attitudes. This is kind of that self moderation of ourselves that we need to do in order to kind of a self evaluation of our feelings and our culture and what we believe so that we can respect someone else's. We do need to ask patients what they expect in their health care, so that we can provide them the best possible care for their values. Here in the United States, we have our own unique blended culture that impacts how we care for individuals and how individuals take care of their health. It's very important that the nurse is aware of attitudes and values, um, and of the patient and also of themselves so they can understand how this impacts their mental health and their mental illness. By looking at your um, identification and the patient's identification, that can prevent stereotyping when you are assessing and providing care to in a culturally sensitive manner. We do know that minority cultures and low income groups do face disparity in healthcare. Um, Things like lack of insurance, lack of access, cultural biases, and language barriers. So we need to think of all those things and how we are going to um, deal with them. Other things that are healthcare disparities is psychiatric emergency services, involuntary hospitalizations. Um, by not understanding sometimes, we can make assumptions that aren't based in fact. Um, Emergency treatment after interactions with the law, overdiagnosis of diseases like schizophrenia, higher doses of antipsychotic medications, and less likely to receive the care that they need for things like depression. The reasons for this are complex, but if you're a nurse working with a diverse populations, you need to have an idea of cultural awareness, the existing disparities, and have a commitment that all individuals, regardless of culture, ethnicity, and other differences, get appropriate care. And we can do that for a lot of different ways. One of the things is to ask, to do an assessment of their cultural background, their cultural beliefs, and to ask those questions. Um, if it's appropriate, ask family for their help with interventions. And just things to make sure that we are providing the best care we can and maintaining their cultural beliefs.